Hi, everybody. Welcome to this event. I am Ashrafunnahar Misti. I pleased to moderate this i2i webinar, which has been organized by the i2i consortium. There is some accessibility and housekeeping information before going further. To ensure full participation, to ensure full accessibility and inclusion, I would like to inform you about accessibility and housekeeping rules. This event provides international sign interpretation for those who would like to have the multi-pin options enabled. Please connect the host through the chat box. You can also actively the real-time captioning as subtitles here on Zoom or through the external link provided in the chat box. All attendees are in the listen on mode with cameras off. Please use the chat box for technical questions and the question and answering box for content questions. The meeting is being recorded and will be shared online afterwards. A post-event survey will be launched automatically after we close the event. Please complete it. We will use your feedback to improve in future. Now, let me give you a little bit of background. The Innovation to Inclusion i2i program is a 3-year project funded by UK government's Foreign, Commonwealth and Development Office, FCDO, that aims to deliver direct and sustainable change for women and men with disabilities in Bangladesh and Kenya by supporting them to access waste employment in the private sector, led by Linda Cheshire with a diverse group of international and local organizations. Do not forget to tweet during the event. There is some tweet information, hashtag disability inclusion, hashtag nothing about us without us, hashtag disability inclusion, hashtag GDS22, etc. As I said earlier, I am Ashrafunnahar Misti. I am founder, executive director of Women with Disabilities Development Foundation located in Dhaka, Bangladesh. Today, we will be talking about a learning document that has been produced by i2i, capturing the experience of organizations of people with disabilities in Bangladesh and Kenya from work that they have done advocating for disability inclusive employment and social protection in their countries. This used to influence policy change by DPOs or OPDs. I should mention that sometimes we said OPD, sometimes we said DPO. Both mean the same things, an organization run and for by persons with disabilities. First, we will hear a little bit about the background of the project, the advocacy work, and how the learning document was produced. Then we will hear directly from OPD representatives from Bangladesh and Kenya. Lastly, we will have question and answering session where you can put your questions and options to the panelists. At any point in time, please put your questions about in the content in question and answering box. I would love to request you that when you speak, please speak slowly because there is interpretation. Now, I would like to go in the first part of the webinar. We will hear from Jaz Soban, who works for Lunar Cheshire, and Gordon Rattray, who is within European Disability Forum. Jaz and Gordon have both been very much involved in i2i, and they briefly tell us about data-driven advocacy. Learning is integral to i2i, responding to COVID-19. Please, Jaz and Gordon.
Good morning, everyone. Good afternoon, everyone, depending on where you're joining us for. Thank you very much, Misty, for that fabulous introduction, and also for moderating today and this webinar. So, as Misty has already indicated in her welcome, the learning from the data-driven advocacy outlined in the document we are talking about today is a component of a much larger pathways to employment program involving 10 consortium members, each contributing to the overall program through their individual activities. The data-driven advocacy element is led by Leonard Cheshire and the European Disability Forum, and of course the 10 DPO partners, 10 in Bangladesh, 10 in Kenya, that were the i2i partners and where the program has been based. OPDs in Bangladesh and Kenya participated in 2 different sets of workshops. These spanned several days, and they were initially intended to be face-to-face in order to maximize participation and interactivity. We managed to do that with the first workshop in Bangladesh, but as we'll find out later, the rest of the workshops needed to be moved online because of the pandemic. So the first workshop that we held was to identify how to gather data or information on how their countries, i.e. Kenya, Bangladesh, are implementing the UN Convention on the Rights of People with Disabilities, and the Articles 27, which is about employment, and Article 28, which is around social protection. The second workshop was several months later, after a period of actually doing the data collection. And this is where the OPDs in each country identified priorities relevant to their context. So in other words, the second workshop, after you'd had the data collection period where the OPDs were working with mentors and collecting the data, they then had a second workshop which actually helped them to identify those gaps in the context, which they then used to design their strategy for an advocacy campaign within that country. The OPDs then went on to implement those advocacy campaigns. I'm going to pass over to Gordon now, who's going to talk a little bit more about the learnings. Gordon, over to you.
Thank you very much, Jaz, and thank you again to Misty. Yeah, so learning is an integral part of the Innovation to Inclusion, the i2i program, and as Jaz mentioned, there are 10 different partners who have all been working on different aspects of disability inclusive employment and social protection throughout these 3 years. And because of this, there will be many different learning documents produced by the i2i program. And these documents aim to inform all different stakeholders, from NGOs, international NGOs, non-governmental organizations, OPDs, DPOs, government departments, and individual people. But this event today is focusing very much on one learning document in particular, which is one that has been produced by the organizations of persons with disabilities in Bangladesh and Kenya. which is really looking at what these organizations have learned in the implementation of their advocacy work. So it's really identifying the things that they've learned, the experience that they've had, both from their own perspective and also for other stakeholders. And as Jazz also alluded to, as you all know, the COVID pandemic started actually just a couple of months after we had started the i2i program. So we had to switch a lot of our work. And in fact, we took it as an opportunity rather than just being a challenge. And we identified, for example, challenges that people with disabilities in Bangladesh and Kenya were having due to the pandemic. We produced an influencer pack which in 2020, which gave organizations advice on how to include persons with disabilities in the pandemic. So as well as the initial plan to just focus on Articles 27 and 28 and disability inclusive employment and social protection, the i2i program has also dealt with the COVID pandemic. Thank you for that. And next slide, please. And I think we switch back to Jazz. Jazz, are you joining us again?
I can. In terms of what happens next, I think we're actually moving on to the panel discussion. Gordon.
Jazz, the slide is on the process, the focus group discussions and the...
Sorry, I've had a connection break. I've got it. A big apologies. Big apologies, everyone. So, my camera, the problem with doing live events is that when everything goes wrong, it really goes wrong. So the in terms of the process that we took for developing the learning documents, there was a very specific program that was really important to ensure that we included all the OPDs that we were working with. And in order to do that, we wanted to work specifically, first of all, with focus groups and focus group discussions, both within each country, but also as a group. We also did a series of individual interviews after each focus group, and these interviews were really to gather a lot more detailed qualitative information in terms of people's individual experiences. We also took the decision to have an online party, and the online party was basically where we brought both OPDs from Kenya and Bangladesh, who had been kind of working separately in terms of gathering the data and contributing to the learning document, to a party where everybody had an opportunity to network and to talk and to share experiences and learning from their own particular perspective. These included polls, a photo exhibition, and a whole range of other kind of activities, really to promote discussion and networking, and to see where there was crossover. In terms of an experience for those of us who were very involved in the program, it really provided a culmination of what had been a really good, rich dialogue throughout the last 3 years, really, in terms of ensuring that participation was meaningful with the OPDs, and the way in which, you know, we learned from them and they learned from us, and that was then fed into what we hope is into a very rich learning experience and document. I think I'll leave it at that now and hand back to Misty.
We have one more
thank
for
you.
me. One more slide for me to speak, and then, sorry, Jazz. Sorry, Misty.
Yes, got
So just to finalize what Jazz was saying on the slide that now shows, as Jazz mentioned, the priority for the learning document was to make sure that we had meaningful engagement of the OPDs. So although the learning document was produced by European Disability Forum and by Leonard Cheshire and coordinated by an independent consultant, it really brought in the priorities and the content ideas of the OPDs, and the OPDs advised on how to produce the final product. And secondly, it's important to mention that the process really adapted to reality. So there were challenges all the way through, including workload for the OPDs, the time that people had, and internet connection, of course. And we made sure that this was addressed from the beginning, providing information and meeting formats in different ways. For example, obviously we provided translation and sign interpretation, but we made sure that people were able to participate in different kinds of meetings that suited their requirements. And lastly, of course, the final document is fully accessible. So this was non-negotiable from the beginning. It was designed by a designer who understands accessibility, and then audited for accessibility before final production. And I think we have in the chat the links to the final learning document and also to the influencer pack that I mentioned earlier. So with that, definitely handing back to Misty. Thank you very much, Misty, and back to Jazz.
Thank you so much, Gordon. Thank you, Jazz. Now we have all the background. We will dive into the detail of the papers. For this, we have two representatives from OPDs in Bangladesh and two representatives from OPDs in Kenya. Let me introduce them. Jahanara Begum, known as Hannah, the General Secretary of Alliance of Urban DPOs Chittagong, a partner OPD of i2i program. Hannah is also President of Women with Disabilities Development Association and an executive member of District Disability Rights and Protection Committee in Chittagong under the government. Her key interest is in education, disability and development, women empowerment and gender. Mike Gu is a program coordinator at Tinada Youth Organization, a Kenyan partner of i2i, a human rights advocate. Mike is passionate about people with disabilities, especially mental health and psychosocial disabilities. He uses his own journey out of addiction to inspire and support other young people facing the same. He sees a society where people with disabilities enjoy full rights, free from stigma and discrimination. Mohammad Iftekhar Mahmood is a coordinator for the Bangladesh Society for the Change and Advocacy Nexus, BSCAN, where he works for the well-being of people with disabilities and to combat all forms of discrimination. Iftekhar has previously worked for the Visually Impaired People Society, the National OPD Alliance of প্রতিবন্ধী নাগরিক সংগঠনের পরিষদ and concerned women for family development. Shiobhata Kilonjo has over 8 years experience in disability advocacy. She holds a degree from the University of Nairobi, Kenya, and postgraduate diploma in the project management from Kenya Institute of Management. She is the project and communications officer at the Ecumenical Disability Advocates Network EDAN in Nairobi. As I said, our aim to discuss some key aspects of learning paper. This will take about 30 minutes, which we will divide it into two sections. First section will talk about learning that are useful for organizations of persons with disabilities OPDs, and the second section will talk about the learning that are useful for others, including government departments, non-governmental organizations, and NGOs. So let me begin with the first questions. Part 1, learning points of OPDs. The document talks about the meaningful investment of the rights holders. This should like jargon. What does it mean in practice? And can you give any example, good or bad? I will put this question first to Iftekhar and then to Shubhata. Iftekhar, please.
Thank you, Mr. Appa. It's true that meaningful engagement of persons with disabilities is very important, especially in the aspect of youth development agenda. In this case, persons with disabilities under CRPD Article 4, Article 29, 33, and 34. All the articles emphasizes that the persons with disabilities have right to participate in any decision-making, monitoring, evaluation, and implementation stages. The state party has liability to make persons with disabilities not only as a one-sided or silent stakeholder, but also active and full participation of them in the decision-making process. And these decision-making processes have to be accessible in all sorts of persons with disabilities, irrespective of disability. And you know, there is involvement has to be started since the decision-making process and ends up from the evaluation stages. So all the levels, whenever it started from the beginning, it will help to become a CRPD-centric development agenda. Thank you.
Thank you, Misty. Thank you, Iftekhar, for that response. I will add on to what Iftekhar has said, and I will want to further expound on what a rights holder is. And a rights holder is an individual or a social group with certain entitlements in relation to specific duty bearers. And who is this duty bearer? A duty bearer is a political decision maker or other authorities with the responsibility of fulfilling and protecting the realization of rights. Iftekhar has given us what it entails to have meaningful engagement according to the CRPD. I will take it further from the experience that we as DPOs, as OPDs, we took it upon ourselves at the start of the project while we were doing data collection to find out how can we engage meaningfully with the processes, or rather with the decision-making processes. While we were at it, we realized that the government of Kenya was in the process of repealing Social Assistance Act of 2013. So what we did, we reached out to the National Gender and Equality Commission here in Kenya, and we asked how
আমাদের
can
সমাজে
we engage
জেন্ডারের যে
meaningfully as
বিষয়টি রয়েছে
DPOs with this
এবং আমরা
process?
প্রতিবন্ধিতা জেন্ডার
And
এই
the
বিষয়গুলো
National
সম্পর্কে
Gender
সচেতনতার
Equality
যদি কোনো বিষয়
Commission listened
আমরা
to
বলতে
us.
চাই সেখানে
They organized
ওপিটি
a webinar together with Top Aid
সম্মিলিতভাবে
International,
যদি তারা
together with the Social
তাদের কথা
Protection
বলে
Actors Forum
আমরা
in
বিশ্বাস
Kenya,
করি যে এটি
and
একটি
the
চমৎকার
ministry
সমাধান হতে
responsible
পারে এবং আমাদের
with the
কেনিয়াতে
process of repealing
দায়িত্বপ্রাপ্ত
the
যে
act.
মন্ত্রণালয় রয়েছে
And
তারা সঠিকভাবে কাজ
they took
করেছে
us through the Social Assistance Act of
এবং সবচেয়ে গুরুত্বপূর্ণ যে
2013 as DPOs.
এখন
They
পর্যন্ত
told us
আমাদের
where
দেশের
we can identify the
যে
issues and the
ডিপিও
reason
রয়েছে
as to why the government was repealing the act.
ডিপিওরা বলেছে আমাদেরকে এখন
And
পর্যন্ত
we
সরকার
as
এবং প্রতিবন্ধী
DPOs,
মানুষরা
together with other stakeholders,
বিভিন্ন
we
সময় বিভিন্ন
joined
কাজ করতে
together
গেলে
and developed a common
যথেষ্ট
position paper. And this
দ্বিমতের তৈরি হয়
opened the doors for government and
এবং
other decision
প্রতিবন্ধীদের
makers to engage us. I
অর্থমূলক
remember we
একেবারে
received an
অংশগ্রহণমূলক যে বিষয়টি
invitation
রয়েছে
from the
তার
National
মাধ্যমে
Assembly
সরকারের সাথে কাজ করার একটি
DPOs
চমৎকার
to
দিক
engage
উন্মোচিত
with the
হয়েছে
process by
এর মধ্যে দিয়ে
writing
আমরা বিশ্বাস করি
a
যে
memorandum
প্রতিটি
to
ক্ষেত্রে
the government.
প্রতিবন্ধী মানুষরা
Later
তাদের
on in the
প্রয়োজনীয়
year
মতামত
2021,
তারা
we also
যথেষ্ট
received another
চমৎকার ভাবে দিবে
invitation
এবং এর মধ্যে
from
দিয়ে
the committee
আমরা
of the
বিশ্বাস
Senate
করি
in
যে
Kenya, which deals with the
কেনিয়াতে যে
social welfare,
প্রতিবন্ধী মানুষের
inviting
জন্য
us for
প্রতিবন্ধী
a
মানুষের কল্যাণের জন্য
one-on-one
যে কমিটি রয়েছে
discussion with
তারা
them,
সঠিকভাবে কাজ করছে
identify the
এবং
issues, how can they
প্রত্যেকেই
be addressed
প্রতিবন্ধিতার প্রত্যেকটি
in the
বিষয়
new
চমৎকারভাবে
bill?
চিহ্নিত করে নিয়ে
How can
তারা
persons with
সঠিকভাবে
disabilities
সেই
feel
পদক্ষেপ
that their rights are
গ্রহণ করবে
protected and they
এবং
are
আমরা
going to be
বিশ্বাস করি যে
realized
এর
in
মাধ্যমে
terms of social protection
প্রতিবন্ধী ব্যক্তিদের
in this
অধিকার
bill? So
অত্যন্ত
it was
সুচারুভাবে
up to us, the
সুনিশ্চিত হবে
DPOs, to be proactive and
এখানে
look
বিশেষ
for
করে
ways
উল্লেখ্য যে
to engage
ডিপিওরা
with the decision-making
বিশেষ করে এখানে
processes.
অত্যন্ত
We
মুখ্য
continued as
ভূমিকায়
DPOs
অবতীর্ণ হতে
in
পারে
Kenya to
এবং
engage
ডিপিও
with that
যদি
process,
কেনিয়াতে
and we can
তাদের
say
বিভিন্ন
yes, our
কার্যক্রমের মাধ্যমে
engagement has been meaningful. The
প্রতিবন্ধী ব্যক্তিদের
government and the
যে
decision makers
অংশগ্রহণ
have given us that
সেটিকে নিশ্চিত
space.
করতে পারে
They
তাহলে
have provided the
সিদ্ধান্ত গ্রহণ
reasonable
প্রক্রিয়াতে যারা
accommodation,
কাজ করছে
and
সরকারি
it's
পর্যায়ে
all because
তাদেরকে
we
অবশ্যই
took the
প্রভাবিত করতে হবে
initiative as
এবং
the
এর মধ্য
DPOs,
দিয়ে
and that was
প্রতিবন্ধী
our
মানুষরা
learning. We don't just
ডিপিওর
wait
মাধ্যমে
seated
তাদের
to be
প্রয়োজনীয়
invited.
কথা তাদের
We also
অধিকারের
go
কথা
out there
তাদের
and look for
নিজস্ব
that
প্রয়োজনের কথা তারা
opportunity
প্রকাশ
to
করবে
engage
এবং
meaningfully. Thank
এবং
you.
বিশেষভাবে
Thank
তারা
you
এই
so
সুযোগ
much,
পাবে অনেক
Shobhata.
ধন্যবাদ
Now I have the
অনেক
second
ধন্যবাদ
question.
সুবার্তা
This project really focused on data-driven advocacy. Can you give clear examples of where focused data has helped in your advocacy work? I will put this question first to Hannah and then to Mike.
আমি হেনার কাছে প্রশ্ন
Please,
করছি
Hannah.
যেহেতু এটি একটি ডাটা ড্রিভেন অ্যাডভোকেসি প্রকল্প আপনি কি বলতে পারেন আপনার কাজের ক্ষেত্রে বিশেষ করে অ্যাডভোকেসি কাজের ক্ষেত্রে কোন
Hello
কোন
everyone,
বিষয়গুলো
thank you
কাজ
Ms.
করেছে
Tiapa for giving the floor
প্রত্যেককে
to
ধন্যবাদ
speak.
মিষ্টি আপাকে
This is
ধন্যবাদ
Hannah from Bangladesh, Alliance of Urban DPOs in Chittagong,
আমি হেনা
located in
বাংলাদেশ
Chittagong, Mayagara.
ডিসেবিলিটি অ্যালায়েন্স টিভিও থেকে বলছি
It's a very important question too for us, data
এটি আমার
gathering.
জন্য
You
অত্যন্ত
know that
গুরুত্বপূর্ণ
when
প্রশ্ন
data is important for persons with
এবং
disabilities.
প্রতিবন্ধী মানুষের জন্য যে
When
তথ্য
we
সেটি অত্যন্ত জরুরি
started i2i project,
আমরা i2i
that
প্রজেক্ট
time
যখন শুরু
we
করেছিলাম
don't have any
তখন
data
কিন্তু
for persons with
আমাদের জন্য
disabilities
বিশেষ কোনো
because
তথ্য
of
সঠিক কোনো তথ্য আমাদের সাথে
we
ছিল
are
না
working at 27 and 28
আমরা যেহেতু
employment and social
সিআরপিডি
protection. Due to COVID-19 situation,
27 এবং 28 অনুচ্ছেদ নিয়ে কাজ করছি
due to
যেখানে
COVID-19
প্রতিবন্ধী
situation,
ব্যক্তি
we
কর্মসংস্থানের কথা বলা হয়েছে এবং সেখানে প্রতিবন্ধী
started
ব্যক্তিদের
a data gathering process
কি বলে
beginning.
অধিকারের কথা বলা হয়েছে
That time
এই দুটো
we
জায়গাতে
saw
আমরা
that many persons
প্রতিবন্ধী
with
মানুষের জন্য
disabilities are
প্রয়োজনীয়
lost
উপাত্ত
their
সংগ্রহ
job
করা
in the
এবং
pandemic
সেই
situation.
উপাত্ত সংগ্রহের মাধ্যমে
Besides
প্রতিবন্ধী
of
মানুষদের
this,
যে কর্মসংস্থান কিভাবে
Bangladesh government
একটা
has
সঠিক পর্যায়ে নিয়ে আসা
total
যায়
data, but there
সেই
is
জায়গাগুলোতে
no
আমরা কাজ
specific
করেছি
data.
কিন্তু
How
তথ্য
many
সংগ্রহ করতে
people
গিয়ে
are
আমরা
involved
দেখেছি যে
in
একই
employment
সময়ে একই
sector
সাথে
and how many people are lost
প্রতিবন্ধী
their
মানুষের
job
যে
in
কর্মসংস্থানের যে
COVID-19
জায়গাটা
situation.
সেই জায়গাটাতে সঠিক তথ্য নিয়ে আসাটা অত্যন্ত
So
কঠিন এবং
when
দুর্লভ
we collect this data and
যখন আমরা এই
through
উপাত্ত
this
সংগ্রহ করছিলাম
project and we after that collecting data, we submitted full data to our government, and I think it is a very good thing for us if we used this data for next work. In behalf of this work, you know that we are working on also UNCRPT 28 social protection. You know that we through this project we raise our voice about caregiver policy. You know, and there are no data for how many people CBR persons with disabilities. There is no data. If we have any data of this issue, I hope the advocacy will be very helpful when we implement the policy and next work. So I think i2i through i2i project, which is already we gathered the data. I think in the future our government and non-government also it will be very helpful for them, for us, and also if DPOs are directly involved in these things. And you know that our government and duty bearer are very sometimes they are positive, sometimes we saw that there are some ignorance about the issue. So if they have no any data or they have no specific data for employment sector or social protection, if we cannot take any advocacy for the issue. So data is important for advocacy. I hope it is very important for us.
Thank you so much.
Thank you.
Mike, do you give some examples and answer on this question?
Thank you very much, Misty. And also thank you very much, Hannah, for going ahead and just explaining where the situation we were at in terms of lack of data. I just wanted to come in, maybe just talk about maybe examples of how we have seen data helping us in our advocacy work. And I would go straight into speaking about that there was lack of data, especially in terms of issues around work and employment, and also in terms of issues of coverage of persons with disabilities in terms of social protection. But with the data that we were able to generate, then we have been able to use it and advocate to the decision makers, and we were able to see some changes. And one of the major changes that we've been able to see is that we have seen that the private sectors are coming up on board to employ more persons with disabilities, because you find that Kenya has a policy whereby 5% of the workforce in any institution need to be persons with disability.
Mike, do you speak slowly, please? Mike.
Yes.
Yeah.
Need to be persons with disability. And you find that this policy has not been implemented, especially in the private sector. We have seen it at least being implemented in the public sector, that is in government, but the private sector were not implementing it. So we have gone ahead and advocated the use of data in terms of the persons employed in the private sector, and got the private sector to come on board and actually employ more persons with disabilities. The other aspect also that I can speak about is the aspect of social protection, whereby we saw that persons with disability were not being covered in terms of social protection, especially when it comes to issues of health. And as a result of using data to advocate, then we have been able to see an increase in terms of persons with disabilities who are being given the health, we're being put into the health insurance scheme, even that which is brought about by the government and even by county governments, not only the national government, but also the county governments. We are seeing persons with disabilities being brought on board. And then The other aspect that we have been able to see advocacy through data coming very handy is the aspect of persons with disabilities accessing healthcare at health facilities. There was a lack, especially in terms of services being rendered to them as a result of lack of persons who are trained in sign language. So through advocacy work using the data that we had collected, we have been able to see the county government also take up the challenge and endeavor to train health personnel in sign language, such that persons with disabilities, especially the deaf, are able to be attended to when they visit these health facilities.
Thank you so much, Mike. I want to go the next question. Due to time limit, we have to go for next question. Following up the previous question, how does the factual data complement anecdotal evidence? Are both of these necessary? I will put this question first to Iftekhar and then to Mike. Iftekhar bhai, please.
Thank you, Mustafa. Data is very important, especially when it is advocating with the government to realizing the situation. Rightly said by Janar Hena and Mike. And example is also playing vital role there. Whenever we are mentioning data, if we include some example, these can be visible to the duty bearers what is the real situation or scenario. Such as during the COVID-19, we know that many people have lost their jobs as well as persons with disabilities. But whenever we have submitted some case stories, especially those who are persons with disabilities, both male and female, have lost their jobs in stable jobs in no time, but they have fallen into a severe situation. You know that we are advocating to provide unemployment allowances as well as unemployment insurance scheme to the persons with disabilities, wherever it is, through the Ministry of Social Welfare or the Ministry of Labor and Employment or Insurance Development Regulatory Authority. So whenever we are putting these examples to the duty bearers, they can be it can be easier to realize the situation and take necessary steps. So I hope this condition will help us how it is vividly gone through. We have submitted some examples such as especially in the works in RMG sector, while a large number of persons with disabilities as employed. But due to the COVID-19 pandemic situation, the job has curtailed a lot, and within this, some persons with disabilities have lost their jobs in Dhaka Ashulia. So we have prepared a case study and submitted to the ministries to notice that how the persons with disabilities have been suffering this sudden job curtain. So disability allowance as well as the unemployment insurance is essential to socially protect themselves. Thank you.
Thank you so much, Iftekhar bhai. You given a very important example which is happening during COVID-19. Now I go to Mike, please.
Thank you. I would be very brief on this, just to say that there is factual data complements anecdotal data or evidence in a very big way, because you find that the factual data comes from credible sources, And so from these credible sources, then we are able to bring in anecdotal evidence. And these can be even in terms of having human interest stories. And these human interest stories, sometimes they speak more towards the data. They give a human face to the data. And so through this anecdotal evidence, we can be able to evoke empathy, especially from the decision makers, and get them to act on the issues that need them that need action on. So anecdotal evidence and factual data complement each other in terms of achieving objectives. Thank you.
Thank you so much, Mike, for your brief answering. I have the last question for this part. The learning documents talk about the importance of relationships between the rights holders and the duty bearers. Can you elaborate on this? Please keep your answering very short because we have time limitation. I put this question to Shubhata and to Hannah, both of you.
Yeah, briefly, the importance of relationships in advocacy is to ensure we have meaningful engagement, as we had earlier on talked of. We need to have a common understanding between the duty bearers and the rights holders on the advocacy issues. And for us here in Kenya, when we started these projects, building relationships between rights holders and duty bearers was a strategy for us to conduct advocacy. And we saw it as a creative way to do it. And we mainly, as DPOs, created relationships with the mother ministry where disability is located. And we did this by having regular dialogues, trying to see what they are doing, and also inviting them to our activities. And from that, we were able to create a good working relationship where the data we had collected in this project could inform the decisions that the mother ministry was doing together with the other decision makers. And because of this relationship, we saw the ministry started to engage DPOs. I remember they reached out to us during the Conference of State Parties last year, asking us to come and help the government shape its position paper before they traveled to New York. And we were also able to be called upon to come as DPOs together with other stakeholders and have a meeting with the permanent secretary in the Ministry of Labor and Social Protection and discuss issues around Article 27 and 28 of the CRPD and see how we can move the agenda forward from the time Kenya did the reports to the CRPD in 2014. And surprisingly, during the International Day on 3rd of December, 2021, the ministry also reached out to DPOs, come help us plan. And they had invited the president and they asked us, what are the issues do you want be put in front of the president to address? And we helped them develop the issues, and they also helped us and identify people with disabilities to speak during this event. And actually we saw results immediately because the president was able to give some directives, including on persons with disabilities being facilitators to get a smart identification card. And finally, just beginning of this year, we had the ministry calling on us, come people with disabilities, so that we plan for a mini disability summit before the main one on January 20th, and we did that gladly. So building relationships helps. And on the other side, we also want to have allies who are going to strengthen our voice in this advocacy. And for us, we did that with the media. We created a relationship with the media, and we have seen the media coming in for us. Thank you.
Thank you, Shubhata. I want to just hear from Hannah very shortly, Hannah, because we have to move for part 2. Hannah. You are muted, Hanapa. You can make unmute and then, yes, thank you.
Okay, thank you, Ms. Tiapa. So Bata already explained about the relationship rights holder and duty bearer. I just some example which is we faced in our location. Relationship is a very important part of advocacy with the rights holder and duty bearer. For example, we started work in our location, I mean, in Chittagong City. There, first time when we go to a government site or government offices, different government offices, they have no idea of persons with disabilities, they are ignorance. But when we go to meet with them, when we talk to with them, day by day, we build our relation to government and government and other political members, and they are try to understand us what's happening actually, and we try to focus our situation, and we try to say what's we need, what we why we go to their, what's their duty. Always we try to speak about our rights, and they also first they are try to avoid, try to ignore us. But when we advocating with them and raising a good relationship with the duty bearer, and then now they are changing. They are now changing. Sometimes they try to give some information. Now they are calling us. Yes, Hannah, come here. We are going to organize a program. Please come. Please send some people, persons with disabilities, to join this program. Now this is the situation, and I think this is the relationship between duty bearer or rights holder. If we do not go there, if do not try to say positively, they are not understand about the issues. That's why I think it is a very good thing for rights holder and duty bearer. Both sides of we have to focus our rights and our voice. And
thank you so much,
positive.
Sanapa. You rightly mentioned that raising voice is very important to make relationship with other stakeholders, especially the government. And now we move to the part 2, learning points for all other stakeholders. There are also several questions which we can make for you, the panelists. Number one question is, one thing I often hear that the time begin disability inclusion is now. Why it important to incorporating data gathering process and indicators into the projects from the beginning? I'll put this question first to Hannah and then Iftikhar.
আমরা প্রথমে এই প্রশ্নটি হেনাকে করছি এবং পরে ইফতিখার ভাই বলবেন। হেনা আপা।
Thank you, Ms. Tiapa, again.
ধন্যবাদ মিস টিপা আপনাকে।
When we try to achieve anything, we should start first.
যখন আমরা
if we not start first, we cannot achieve. This is our thing. Suppose we start a project or event, we have to clear about the project or data, anything else. If we started any program, we any project, we need to clear data. We need to clear budget. We need to clear and specific status for the project. Because of why we started this beginning. Because of we do not started this beginning, we cannot include mid-time. For example, our experience, I want to say, suppose we done some programs or project, we not included our regional accommodation related part. We do not include other accessibility issues. That this is the big thing for this project. But I think this is for important. If we started everything before project, then it will be very helpful for this project. Suppose if we work for persons with disabilities through this project, we have to contact persons with disabilities as well as DPOs. Because of why we want to contact with DPOs? Because DPOs knows their evidence. DPOs, persons with disability knows what they are happening in their location, what the situation in their area. So other people don't understand what their problem, what's their needs. That's why I think it is very important.
This is very nice to hear from you about the inclusion. Persons with disabilities involving in different projects. Also, there is specific budget and policies. So I want to ask Iftikhar Bhai, if you mention about the policy, budgeting, etc. That would be
আমরা ইফতিখার ভাইয়ের কাছে নীতিমালা সম্পর্কে এবং তথা সম্পর্কে জানতে চাই। ধন্যবাদ মিষ্টি আপা।
It's really true that since the inception of any project, we should include the issues of persons with disabilities. So whenever it started from the very beginning, it will be easier to adopt in the later stage.
তাহলে অবশ্যই লক্ষ্যে পৌঁছানো কঠিন হয়ে যাবে।
And it become cost effective because whenever
আমরা যদি সঠিক নীতিমালা এবং ডাটা সাপেক্ষে কাজ শুরু করি, সেটি আমাদের জন্য অত্যন্ত আমরা মনে করি যে কম ব্যয়ে আমরা আমাদের কাজ বাস্তবায়ন করতে পারি এবং আমরা প্রতিবন্ধী মানুষের র্যাম এবং অন্যান্য প্রবেশাধিকার বিষয়ে যে সমস্ত তথ্য দেওয়া হয়েছে সেগুলো মাথায় রেখে আমরা কাজ করতে চাই এবং প্রতিবন্ধী মানুষদের মূলত প্রকৃত অংশগ্রহণ নিশ্চিত করার ক্ষেত্রে আমরা বিশ্বাস করি যে ডিপিওদের সাথে কাজ করতে গেলে বিভিন্ন কৌশল অবলম্বন করে করতে হয়। দ্বিতীয়ত, বাংলাদেশের বেশিরভাগ এনজিওদের ক্ষেত্রে যে বিষয়টি ঘটে, তাদের উন্নয়ন পরিকল্পনায় প্রতিবন্ধিত বিষয়টা সঠিকভাবে সম্পৃক্ত হয় না। সুতরাং আমরা বিশ্বাস করি যে প্রতিবন্ধী মানুষের জন্য কাজ করতে গেলে অবশ্যই প্রতিবন্ধী মানুষকে সাথে নিয়ে তাদের কথা শুনে আমাদেরকে প্রত্যেকটি কাজ ডিজাইন করতে হবে, অথবা আদর্শগতভাবে আমরা প্রতিবন্ধী মানুষের জন্য সঠিকভাবে আমাদের সঠিক জায়গাতে আমাদের কাজ নিয়ে এগিয়ে যেতে পারবো। আমরা বিশ্বাস করি যে আমাদের কাজ বাস্তবায়নের ক্ষেত্রে প্রতিবন্ধী মানুষদের তথ্যপত্র সংগ্রহ করে কাজ করব। অনেক ধন্যবাদ ইফতিখার ভাই আপনাকে।
We have 6 minutes only for discussion. We have 2 questions already, so I will go for second question, and I will ask Shubhata for answering this question, and next question will answering by Mike. So I have the question to Shubhata, that the learning document says that stakeholders should plan for shocks. What is this mean in practice? Shubhata.
লার্নিং ডকুমেন্টে বলা হয়েছে যে
প্রতিবন্ধী ব্যক্তিদের জন্য to embrace and respond when change happens and not to react. And
উপাত্ত সংগ্রহের মাধ্যমে আমরা আমাদের কাজে গতিকে স্পর্শ করব, কিন্তু এর মাধ্যমে আমরা কেউ কখনো রিঅ্যাক্ট করব না।
So it is good to plan for shocks so that we can see what opportunities emanate from there for us to be able to scale up the call for inclusion of persons with disabilities in decision making. The other thing as to why we should plan for shocks is to be able to mitigate the negative impacts that could come along with the change. And for COVID-19, it was a high opener. I know most of the stakeholders were not prepared and we were just reacting. And if at all we had been prepared as stakeholders, in the case of persons with disabilities, we would have been able to handle the misinformation that was going around. There was a lot of false information going around. There was a lot of panic. Persons with disabilities were further excluded in many processes in terms of the response by stakeholders. And what we were looking for is to see if at all the stakeholders had prepared for these shocks and the change brought about by COVID-19. We would have seen, even in terms of vaccination, persons with disabilities in our own countries being considered among the very first to be given that vaccine. And also in terms of supporting the most of persons with disabilities were the very first to face the X when it comes to employment. They lost their jobs because the employers could not see how they could continue working with the COVID-19. So basically preparing and planning for shocks enables us to be able to embrace and respond to this change other than acting, taking advantage of the opportunities that are brought about by change and mitigating the socio-economic impacts that are brought about by the change. Thank you.
Thank you so much. Really, it is important to make flexible the project for shocks. The last question to Mike, the learning documents suggest that other stakeholders should support and facilitate OPDs rather than speaking on their own behalf. Can you give clear ideas of what this means in practice? Please do not take more than 2 minutes. Mike, please.
Thank you. I will make this as brief as possible and just say this means that there is need to build the capacity of the DPOs or OPDs simply because one, this is a more sustainable method to attain change, because once you go away, then the DPOs remain and they continue with the work that you've been able to build the capacity to do. And then the other thing that I wanted also to highlight is that a good example can be that for example, the budget making process, whereby you train the DPOs to be able to know how to plug into this process so that they can ensure that their needs are prioritized in these budgets that are made by either the national government or the county government, and that the budgets reflect the actual needs that they face. And in through building capacity, you can be able now to ensure that these the persons with disabilities are able to speak up for themselves and are able to take up their spaces and speak on their behalf in terms of the issues affecting them. Thank you.
Thank you so much, Mike. We have a couple of questions. So Gordon, do I make the question answering session now?
Misty, you can take the questions that have come and put them to each panelist or to all panelists. The choice is yours.
Okay, thank you. Thank you. So the question, first question is from just give me a second, because first question from
Misty.
Yes,
Misty, you should just read the question. You don't need to say who the question is from.
Okay. So anyone from the panelists can answer the question, so we can give more answer, because we have a couple of questions in our hand. Do the panelists have any advice on how to balance the need for disability data with the data protection and the privacy rights of persons with disabilities? Should disability data always be collected on an anonymous basis? How do we balance privacy with the need for segregation? Anyone can answer.
Iftikhar from Bangladesh.
Okay, thank you.
Iftikhar Bangladesh থেকে বলছি।
Mr. Appa, it is very important about data privacy, you know.
আমরা বিশ্বাস করি যে মিষ্টি আপা তথ্য উপাত্তের গোপনীয়তা অত্যন্ত জরুরি।
Data is not preserved as human rights or
যদিও তথ্য মানবাধিকারের মতো খুব গুরুত্বপূর্ণ বিষয় না, কিন্তু তারপরও তথ্যের গোপনীয়তা বজায় রাখা, সংরক্ষণ করা অত্যন্ত জরুরি। এবং আমরা বিশ্বাস করি যে প্রতিবন্ধী ব্যক্তিদের অত্যন্ত স্পর্শকাতর বিষয়ে বিভিন্ন তথ্যপত্র থাকে, যেগুলোকে সংগ্রহ করে তার গোপনীয়তা রক্ষা এবং যথাযথ ব্যবহার করা অত্যন্ত জরুরি বলে আমরা বিশ্বাস করি। এবং আমরা এটিও বিশ্বাস করি যে এই ডাটা সঠিকভাবে ব্যবহৃত হয়। এবং বিশেষ বিশেষ ক্ষেত্রে তথ্যের গোপনীয়তাকে খুব বেশি গুরুত্ব দেওয়া হয় না, কিন্তু প্রকৃতপক্ষে প্রতিবন্ধী ব্যক্তিদের মূল জায়গাগুলো, মূল কাজগুলোকে একটি চমৎকার জায়গায় নিয়ে এসে যদি আমরা নির্দিষ্টভাবে বাস্তবায়ন করতে চাই, সেক্ষেত্রে অবশ্যই ডাটার গোপনীয়তা জরুরি এবং এটি এখন প্রক্রিয়াধীন রয়েছে। বিশেষ করে সিআরপিডি যে 27 এবং 28 যে তথ্য, সেই তথ্য সামাজিক নিরাপত্তা এবং কর্মসংস্থান সেই নীতি অনুযায়ী আমরা বিশ্বাস করি যে এটি আমরা সরকারের কাছে উপস্থাপন করতে পারবো। ধন্যবাদ।
Mike or Shubhata, do you add anything?
Shubhata, আপনি কি কিছু যোগ করবেন?
Okay, thank you. So I go for Mike, please.
Sorry, I was just saying I think he has handled it well, so we're okay with that.
Thank you so much. There is another question. What have you learned most from this collaboration through i2i that you will take forward with you into
এই i2i প্রকল্পের মাধ্যমে আপনারা কি শিখেছেন, যে শিক্ষণীয় বিষয় আপনারা ভবিষ্যতে সামনে কাজে লাগাতে চান?
What I've learned and that I would want to take forward in the future is that as DPOs we cannot work in isolation. We need to work together because we are pursuing common goals, and we need to consult one another, and we need to use data. And in the learning document I gave an example where we approached when the very first time we went to the ministry, we were shocked that the ministry asked the information and they were challenging us. So data collection should be a continuous exercise throughout in our work, and that is one thing that I am going to carry forward, working in collaboration with one another.
এবং আমরা একে অপরের সাথে যদি কোলাবোরেশন করে কাজ করি, এক্ষেত্রে তথ্য এবং উপাত্ত সংগ্রহ অত্যন্ত জরুরি ভূমিকা পালন করে। ধন্যবাদ।
Do you want to add anything, Iftikhar bhai, with this question?
Iftikhar bhai কিছু যোগ করবেন?
Can I add, Mishti Appa?
Yes, Hanapa, please.
Okay, thank you. Sabat is rightly said. Actually, collaboration and cooperation, it's a very important. You know that if we work, we need collaboration with government and stakeholder also. But learning documents is very essential for us and also government and DPOs. So I think it is important to move forward. Yes.
Thank you so much. There is another question that does this advocacy work bring any change beyond consultation, invitation of OPDs to the meeting? I mean, in terms of increase of budget allocation for the National Disability Commission war fund in Kenya. Mike or Shubhata can answer. Yeah.
Yes, I think I'll take that question. And I will just start from highlighting that the issue of increased funds for the National Council for Persons with Disability has been a kind of a headache for us as DPOs, because for the longest time we have been trying to push for that increase in that budget. And so even as we continue to do that, we have diversified our efforts, and that is why now we are focusing at county level and looking into the private sector, to see how the private sector can come in and support persons with disabilities, which will be directly affecting them and not going
Mike, slowly, please.
Sorry. Yes, which will be directly affecting them and not going through the council, so that they can be able to take advantage of this directly. The other aspect that we've been looking into is the aspect of social protection, and that is why we have highlighted social protection, such that persons with disabilities are able to enjoy social protection directly, especially from the county levels where they are, that they can be able to, for one, enjoy access to healthcare, two, they can be able to enjoy access to the support systems that have been put there by the county governments. Like I can mention an example whereby, like in Kisumu County, the social protection department actually has a database of persons with disabilities whom they support with a token every month, just to support them in terms of how they're going to survive and how they're going to live. And this is a top up on top of what is given by the National Council for Persons with Disabilities, which we understand has a very rigorous process in terms of getting that card, which some persons with disabilities have not been able to get, so that they can take advantage of that particular facility.
Is there any data on the progress made in terms of people reached by the Disability Commissioner Fund activities and services? The same question for Kenya. Yeah.
I could take on that one. Yes, there is data, but the quality is wanting. But I know the state ministry, the state department where issues of social protection are in Kenya. They have quality data, and we are able to access it. But in terms of what Mike has said, the government has diversified. We are not where we are when the National Council for Persons with Disabilities was developed. That time the funding was low. It has been progressively increasing, even though not to the tunes of what we want, but advocacy work continues. Yes, there is data, but not to the quality that we are looking for.
Thank you so much. There is also reflection. So if there is no any other question, then
please, your turn.
I want to ask Iftikhar Bhai if there is some any changes in Bangladesh. Do you please describe?
Yes, thank you, Ms. Chiapa. Especially after the advocacy from i2i project for last 2 years, especially from the i2i partners in Dhaka, Chittagong, and Sylhet, we have 3 divisions are working. In Dhaka, we are centrally working to adapt a budget for the persons with disabilities. Through this process, last 2 years, the government has increased the number of persons with disabilities beneficiary. This was before the project in the beginning of 2020. This budget was only 1.6 million persons with disabilities have received disability allowances, while the registered persons with disabilities were above 20 lakhs at that 2 million at that condition. Situation. But now at present, we are seeing that the registered persons with disabilities, the number is around 2.5 million, and the government has been providing more than 2 million allowances for persons with disabilities. So the number of beneficiary has been increasing, and last year's government promised us in this running upcoming budget, they will increase the amount for the individuals. So we hope that this progress will be going up, and the new decisions which is already discussed about the unemployment insurance and unemployment allowances for persons with disabilities, as well as caregiver allowances. These three things, at least one can be included in the upcoming budget. Thank you.
Thank you so much, Iftikhar Bhai. Hanapa, do you want to share any last minute comments or recommendations or any update?
Thank you, Mr. Appa. Iftikhar Bhai already shared everything. I just said this is the time to say what will be happen in our next budget. Actually, you know that through this project, we in locally we collected some information about what is the happening in local division and in other places, and we collect all data to send centrally. So I hope it is very important for our persons with disabilities is next budget. This is included or not, which is we raising about caregiver policies budget, about unemployment issues budget, and persons with disabilities allowance also. So it is, I think government will take the initiative for the persons with disabilities. Thank you, Mr. Appa.
Thank you so much. Our four panelists said very important issues which is going on through the i2i projects. We are coming at the end of our time. From my perspective, it is very important to work together, which we done through i2i project, and we hope in Bangladesh, also hope for Kenya, that the number of OPDs work together and bring a number of changes for the disability inclusion in coming year. So that the end of our event, with that, let me say thank you very much everyone for attending, and particularly thanks to panelists, the organizer, the i2i consortium, and UK Foreign, Commonwealth and Development Offices, FCDO, who have funded the i2i program over the last 3 years in Bangladesh and Kenya. And of course, the huge thank you to our captioners and interpreters. You done amazing things. Lastly, just a reminder that you will now see a link and post-event survey. You also have the link for the learning documents. We would very much appreciate that you take just a couple of minutes to complete this post-event survey for our learning for future. Thank you again. Thank you so much.